Drug contamination in meat and milk is one of the top concerns among consumers. Today, we will be discussing the importance of the Veterinary Client Patient Relationship, or VCPR, and its role in drug residue prevention of edible animal products. You may be asking yourself right now, what is a VCPR? You are not alone. Recently, the Minnesota Department of Agriculture asked farmers who have had drug residues that very same question. We found that while most of the farmers we interviewed have a VCPR in place, either through the Beef Quality Assurance Training or the FARM program, more than 1/3 of those producers did not know what a VCPR was. In this video, we're going to explain the basics of this most important relationship on the farm, the Veterinary Client Patient Relationship. A VCPR exists when a veterinarian takes the responsibility for providing care for your animals and you, the farmer client, are willing to accept the vet's advice. This formal, long-term relationship between the veterinarian and the farmer client can be in either a conversation or a written consent form signed by both veterinarian and client. This agreement is the foundation for quality veterinary medicine and animal care. It ensures the farmer client has access to safe, quality veterinary medicine, including appropriate medications and treatments. Proper use of drugs is one of the most important tasks for a farmer who raises livestock and produces livestock products. Consumers depend on farmers to produce safe, wholesome, uncontaminated quality products and to treat the environment and animals with great care. Producing contaminated products can have real-world consequences. For example, milk contaminated with antibiotics can cause allergic reactions in people with antibiotic allergies. It can inhibit good bacteria important for yogurt and cheese formation, and it can contribute to decreased effectiveness of antibiotics in treating diseases of animals and people through antibiotic resistance. To take action, the first step is simple. Start a conversation with your veterinarian to ensure you have a VCPR in place and to go over the details of your VCPR. Rules and regulations regarding drug management practices are constantly being updated and changed, so it is important to stay in the know with the latest information. Forming a strong relationship with your veterinarian will help you stay informed and organized in the use of medications on your farm. Consider using a checklist like our worksheet to help you get ready for a conversation with your veterinarian. You can ask yourself questions such as, do I have a valid VCPR in place? Discuss formalizing your VCPR in writing. Do I and my vet have the same understanding and expectations around what a VCPR should look like? Do I have my veterinarian out to the farm on a consistent basis? Do I abide by his or her advice? Do I have current animal health treatment protocols? Be sure to discuss the development of written animal health treatment protocols with your veterinarian. This is an excellent way to ensure all drugs used on the farm are administered in a legal manner and to avoid a drug residue violation from overdosing or exceeding injection site limitations. It is also important to determine that drugs are used as the label or as your veterinarian directs to avoid underdosing, which may lead to antibiotic resistance. Finally, ask yourself, do I use any drugs in a different way than is described on the FDA-approved label to treat my animals? This practice, termed Extralabel Drug Use, is highly regulated in food animal medicine and it must be overseen by your veterinarian. Using drugs in an extra-label manner may result in a longer withdrawal time and a residue violation. Having a discussion of all drugs used on the farm can help the veterinarian detect when a producer is using an over-the-counter drug in an extra-label manner. The veterinarian can then properly label the over-the-counter drug with an extra-label drug use label and advise the producer on extended withdrawal times for milk and slaughter. All industry stakeholders benefit from providing excellent care for livestock, preserving antibiotic effectiveness through thoughtful antibiotic use, and producing safe, wholesome, uncontaminated products. Meaningful discussions with your veterinarian in the context of a VCPR can help to achieve these goals. Thanks for watching. For more information, check out our website at www.mda.state.mn.us/residue-prevention.